Doctors, what patient made you go, how the hell are you even alive? We had a guy with a major aortic dissection one night. From the bedside ultrasound, he looked like he had already bled out. He had some chest pain, but he was alert and oriented. We were shocked how he was even still alive. He absolutely shouldn't have been with how much blood we saw and the size of the dissection. We called the surgeon in, who was really blunt, and explained to the guy he was probably going to die in surgery. He was a young guy, like late 40s, he was on a business trip, and it was completely unexpected. He kept trying to call his wife, but it was like 2 a.m. and she wasn't answering. He just wanted to talk and tell her goodbye. It was actually pretty devastating to watch. Meanwhile, he's so coherent and alert as if he isn't actively bleeding out and dying. Most patients we would get in the same situation wouldn't be conscious or would already be dead. They swooped him off into surgery before he could contact his wife, and the dude lived. Remembering that story got me through a lot of tough years in the ER, because I think it just reminded me that hope and good outcomes are still out there. Edit. To those of you with similar stories, know that you're the reason a lot of providers keep doing what they do. Some of your experiences are unbelievable. To clarify some things, late 40s is young for this kind of case to happen. We usually see people dissect in their 70s to 90s. Also, late 40s is a pretty young age to die, especially if you don't have any chronic illnesses. A couple of weeks ago, my ED lost a 30-year-old to COVID. A couple of nurses cried because we consider people twice his age still pretty young. This happened when I was a tech and had only been in the ER for about a year. He was brought in by EMS uncomfortable, but was definitely awake and alert. His ECG was normal, and he didn't have any pertinent history, just chronic HTN and a few minor surgeries. But he was hypotensive and really pale. And when we performed a US, we found what looked like a huge volume of blood in the abdomen and a visible intimal tear. We pretty much immediately diagnosed him with AD and had vascular surgery in the room within a few minutes. I followed up on his chart a few days later and found out he was not only alive, he was already extubated and able to walk. I'm surprised that this isn't as uncommon as I thought. Everyone, I think it's happening. We might have a medical thread that's actually happy for once. I'm not counting on anything for sure, but my hopes are high, which might just mean they have further to fall. Next story. Lady in her mid-30s was in the clinic for 1 week follow-up post-foot amputation, diabetes. She was admitted straight from the clinic because her blood glucose was 600 mg per dl. Normal is 80 to 120, and the wound was severely infected. We used super concentrated doses of insulin to bring it back to the 200s. She was on strict diet restrictions, and we couldn't figure out how it wouldn't drop any lower than 250. Turns out her teens, had been sneaking giant 64-ounce sodas and candy bars into the hospital literally 1 week after we chopped her foot off because of uncontrolled diabetes. Not exactly a case of how the hell did you survive that, but how the hell do you even function on your own? Next story. I work in trauma and once had a guy fall off a roof. He said he remembered hitting the bars on the scaffolding on the way down. We originally thought he'd fractured his femur, but nope, just a small hematoma. He was in bed next to a man who had broken his ribs and had a small C-spine fracture when he fell forward picking up his keys. If I was the guy next to him, I would have been mad. I'll just say it. I would have been so upset. Like, are you kidding me? This guy can go through all that. I take a little tumble forward and end up actually wounded? Man, that is not fair. Next story. I was on home call for ER in a small town. Got a call from the ER nurse one night and she was like, EMS brought someone in here and they think she might be dead. I was like, well, is she? And she was just like, I don't know. This was a seasoned RN, by the way, so I was like, guess we're treating this as a code blue kind of situation. So without any further information, I jump into my car and rush over to the hospital. Once I got there, I realized why the triage nurse was so confused. In the trauma bay lay what appeared to be skeletonized remains under a blanket. The person felt warm to the touch, so I opened their eye, and a yellow, wrinkled, shrunken eyeball stared at me and suddenly moved. Potassium of 1 for those familiar with lab values. The backstory was extreme self-neglect and depression combined with caregiver neglect. Weighed in at about 67 pounds at a height of 5'5". We actually resuscitated her very aggressively, and unbelievably, after about 8 liters of fluid, she started speaking a word or two at a time and recognized her daughter. Next story. As a med student on my emergency rotation, I had a guy brought in who had fallen off a 7th or 8th floor balcony and landed on his head, essentially DOA, and we couldn't get a blood pressure when he got to the hospital. As a student, my job was to basically stand at the side and squeeze the bajillion bags of blood that went into this dude. His cervical spine was essentially dust on the initial CT scan we got. I figured he probably wouldn't have made it, but about a month later, I'm now on my ICU rotation, and I see this guy awake and conscious. Pretty crazy. Next story. During residency, my ICU patient had to have his chest reopened less than an hour after 6-hour open heart CABG surgery. He needed 12 units of blood, his heart massaged, then shocked 4 times. Cardiothoracic surgeon in the ICU operating because no time to go back down to OR. Was an illicit drug abuser and alcoholic. Nurses called him the cockroach. I checked in on him for 4 weeks and he was unresponsive every day. On week 20, we had to consult ENT to take bugs out of his nose. I was sure he was a goner after that. Week 3 passed, no change. Week 4, day 24, I believe, at 6 a.m., he opens his eyes. I was shocked. He has a permanent trach and ostomy now, but somehow is alive. Next story. My dad is 87. He had prostate, liver, bowel, colon, and skin cancer. For the skin cancer, he had lots of reconstructive surgeries, his whole tibia region and the back of his hands. Every year he has to get at least one skin lesion removed. He had a couple of heart attacks and then a sextuple bypass surgery. He also had a big pneumonia, a huge abscess, and a small stroke. His doctor wants to see him every 6 months. I think just to be amazed that he's still walking around. Next story. Patient here. When I was 2, I was being treated for asthma due to wheezing, labored breathing, etc. One night it got exceptionally bad, so my mom took me to the ER. They put me face down to do a CT scan, this was the 90s, and when they were done they turned me back over and I was blue. I'd stopped breathing. CT revealed a volleyball-size mass in my chest. Emergency surgery revealed what was supposed to be my twin. It kept growing inside of my rib cage and finally had nowhere to go in my toddler body, so it cut off my airway. It had fingernails, hair, appendages, everything but major organs. I made a full recovery. I'm now a healthy 31-year-old, 0 asthma. Only remnant of that night is a scar that goes from the center of my chest to the center of my back. Update. This was a teratoma, so it was never a viable human. Bro, you almost got assassinated by your not really kind of twin. That's crazy. I feel like there are books or legends written about this kind of stuff. Doesn't it just evoke Greek mythology to you? Next story. A couple pictures of me before and after brain surgeries were on the front page around this time last year. The mortality rate for acute subdural hematomas is 50 to 90%. Of those who live, approximately 20 to 30% regain any brain function. Due to the subdural hematoma, the bleeding in my skull was so severe I also had cranial herniation. My brain tilted 5 millimeters, causing my brainstem to compress into my spinal cord. That I not only lived but woke up, recovered well enough to get back to work, get married, travel the world, return to baseline physically is a straight-up medical miracle. I'm still in touch with the neurosurgeon who was on call at the hospital that day, and he says the same thing. Next story. My mom's a doctor. I asked her about this when it came up on Reddit. When my mom was in her ER cycle during internship, man with police officers behind him came into the ER. The man was perfectly fine and walking, so my mom and her colleagues were confused. The officers showed them a picture of a crumpled up piece of metal. It ended up being a car. It didn't look like a car at all, just metal trash. The officers told my mom and her colleagues they rescued the patient from the car, which was lit on fire only a few seconds after they rescued him. The patient didn't have a single scar on him. He was perfectly fine and got his name around the hospital for being immortal. Next story. Currently in residency, but this was a patient I saw in medical school. This one has more to do with a patient's past medical history instead of anything acute. Had one patient in one of my internal medicine rotations who was admitted for hip surgery who was one of the nicest, sweetest people I've ever met. Her surgery was pretty routine and there were no complications. In her past medical history, she was diagnosed with stage 4 endometrial cancer that had spread to her brain. Apparently, she had undergone chemo, radiation, primary tumor resection, and surgery to remove the brain met. She remained cancer-free since that period. The fact that she had undergone the whole ordeal and appeared to be mostly healthy and was in remission from her cancer blew my mind. Next story. A guy, now passed away, who had an incurable lung cancer from Agent Orange exposure during infantry service in Vietnam, and his wife had recently died. Cancer. Wife died. Guy was pretty positive, glass half full about chemo considering the double whammy. Asked him how he managed managed to keep it positive. He said he was returning to base with just days left on his enlistment. Rookie pilot has a mechanical failure of some sort in their Huey. They're going down. And not the controlled kind of landing either. He assumes he's about to die. Says everything got real slow, real bright, and a sense of acceptance and peace washed over him. Rookie pulls one out at the last moment, lands their bird with no casualties. Patient told me he felt like he should have died that day, and every single day since was a complete gift. Maybe being alive has a lot to do with attitude. Next story. Obligatory, not a doctor, but my dad is, and he liked to tell us about the crazy crap he saw. This post made me think of one of those in particular. Huge guy, linebacker build, came into the trauma ward with a gunshot wound dead center of the chest. He could breathe fine and he had a pulse. So they did a chest x-ray and found that the bullet had spent all of its energy getting through this guy's sternum and was just resting on his pericardium. Next story. My father's doctor couldn't believe A, he didn't need to amputate his feet, and B, he was still alive. Dad had brittle diabetes. His pancreas would kick in and out due to a congenital deformity. At 82, he had significant heart issues, including angina, enlarged heart, and clogged arteries. One day, his feet went black. Not just bluish or gray, black as charcoal. Rushed to emergency. We were told they would amputate, but to say our goodbyes. Dad refused the surgery, said he would rather be dead at his age. Hours later, his feet were pink. We took him home that morning. Doctor actually apologized for upsetting us, but he said he'd never seen anything like it. Your dad spited some deity. He was like, I'm done, just take me out. And the powers that be said, nah, I don't think so. Not with that attitude. Next story. I'm a psychologist, not an MD or a doctor, but I work at a psychiatric hospital. Anyway, one of my patients a few weeks ago was a 15-year-old boy who was regularly neglected as an infant by his mother, who was an addict. When he was around 5 years old, he was abused so his mom could get drugs. When he was 9, his stepfather gave him a skull fracture after beating him with a wrench. When he was 14, the same man shot him with a pistol for talking back. He's in foster care at the moment and suffers from CPTSD and depression, but he's the sweetest boy I ever met. I wish him the absolute best in life moving forward. He deserves it. Okay, yeah, so maybe it was a little hopeful to say that this one would be happier. Man, can we just get through one thread without a depressing story? Ugh. Next story. Patient here. When I was 7, I had horrible asthma. My mom often lied in my bed with me and listened to my breathing. One night she fell asleep and jerked awake in the wee hours of the night and found I wasn't breathing. Goes to the ER immediately because it was only like 10 minutes away. Not sure what happened while there or what tests they did, but I was declared dead. In the morning, I woke up, asked who I believe was a nurse where I was, and she started crying and called in my mother who hadn't slept all night. The doctor said they didn't know how the hell I was still alive. Now 16 and haven't had any hospital-worthy complications since. Damn it, my mom is the most amazing and loving person on this green earth. Edit. Since a lot of people are asking, I'd been decidedly dead for about 10 to 30 minutes, which is why I wasn't transported to the morgue. Next story. I'm not a doctor, but I did meet a patient who fell from a 5-story building, landed on his upper back, woke up in the hospital the next morning, and got up walking around like nothing ever happened. Barely a scratch on him. I think about it every time I'm in a building with at least 5 stories, just looking down like, how in the world did this guy walk away from that like he fell off a bike and took a nap? Actually, I've seen worse injuries from someone falling off a bike. Next story. Not a doctor, but was the patient. When I was in boot camp, I developed an upper respiratory infection during second phase. I didn't want to get dropped back a platoon, so I gutted through. Got back and went to sick call where they treated me for a host of things. When they x-rayed my chest, the doctors came out with my films and literally asked, "How the hell are you still alive? Your lungs are so full of mucus you should be dead!" Turned into walking pneumonia at some point. I also had athlete's foot that turned into cellulitis and my last wisdom tooth yanked. So the combination of meds they had me on was enough that I don't even remember that week at all. Next story. Obligatory, not a doctor. I'm a funeral director and I received the body of a 90-something man. I could tell he had been sick for quite some time just by looking at his face. Another funeral director did the embalming, so I hadn't seen the rest of his body. Seeing that he was so old and just looked sick, I was surprised when I met with his daughter and she inquired about an autopsy. I asked her my usual questions and discovered that this man for 40+ years had unregulated diabetes. He was also shot on 3 different occasions. He had a history of strokes, bed sores, deep ones, in and out of the hospital for sepsis, pneumonia, heavy smoker, heavy drinker, suffered a major heart attack just days before, his vision was going and he couldn't keep himself awake, horrible jaundice, cirrhosis, had infected kidney removed, and on and on. I don't think this man lived one healthy day in the last 20 years. I asked the daughter, so you want an autopsy because... And she tells me that her father wasn't an ill man and it wasn't his time to go. She's furious I even questioned her request. I'm baffled this man lived for 90 plus years. The denial people can experience in hand with grief is astounding. Next story. So, not the doctor, but the patient. I had a super bad allergic reaction that was a specific type of allergic reaction that was deadly on its own. It would have been deadly if I'd only taken a small bit of the medicine I was allergic to, but the doctor that prescribed it accidentally prescribed about 10 times more what the max dose is supposed to be. So not only was I super allergic, I was also overdosed on what I was allergic to. So that led into weeks of me being in the ICU and doctors thinking I had about a 3% chance of surviving at best. Every time I was conscious and had family visiting, a doctor would tell me to make the most of it because I probably wasn't going to make it to the next visit. Eventually, I somehow recovered, but for about 2 years after I was still regularly going to several doctors to make sure things were okay that were affected by it, every single doctor I went to would hug me and would have other doctors and nurses come in and say something like, "Hey, you don't remember this because you were unconscious at the time, but I helped restart your heart." Or, "I was the person that vacuumed the blood and pus out of your throat that was blocking your air path." And they were all just amazed I made it. It's been about 8 years since it all went down, and I've run into several doctors and nurses around the city that still recognize me and still hug me. It amazes me how in such a large city with such a large hospital that gets the most extreme medical cases from around the world, that they still remember me being there. Edit for some of the questions. 1. It was Stephen Johnson syndrome. Definitely look into it because it may be the closest thing to hell on earth. Your body looks and feels like it's been through a fire and it leaves a ton of permanent damage. Actually, I was one of the worst cases of it, and if I recall correctly, I'm referenced in some studies, just not named. 2. As for the medicine I took, I don't think I should say. I'm not supposed to talk about the situation, and I think people could easily relate it to me. 3. I was actually misdiagnosed for the meds that gave me the allergic reaction. After I got to the hospital, they asked why the hell I was even on it because I had no signs of the thing the medication was for. Next story. We had one of these at an eye doctor's office of all places. Patient was complaining that her new glasses weren't working, so the doctor took her in back to check if the prescription needed tweaking. The doctor came up with a completely different prescription. Patient was overweight but claimed she wasn't diabetic. The doctor convinced her to let us take a blood sugar measurement with a staff member's personal glucose meter. All the meter displayed was high. With some arguing, we were able to get her to go to the local hospital right away. I don't remember what her blood sugar level was, but I remember it was the hospital's high score for a while. She shouldn't have been conscious, let alone functioning normally. Next story. My friend in nursing school was in charge of checking in and out a habitual patient that also was seen by a full nurse and doctor. On checkout, she noticed a bandage on the guy. "Oh, that's for my hole." The guy had an open sore that kept getting bigger and bigger, and he had stuffed 3 t-shirts into it. He had been having repeated health problems, and they just listened to his lungs, would give him an antibiotic, and streeting him. Next story. My mother. We used to live in East Texas, and my mom had this lady come in with a huge infected wound in her leg, like massive, to the point they might have to amputate, and she asked her why she waited so long before coming in. It was obviously festering. Turns out this woman was letting her dogs lick it clean, because their mouths are clean, she said. Oh, and she was soaking it in Dr. Pepper because doctor in the name had her thinking it would help. Needless to say, my mother looked at her like a deer in the headlights when she said that. Edit. Talk to my mom. She also said there were a couple of canine teeth in it because the lady had an old dog. Okay, so not particularly happy, not particularly, devastating, just revolting, man, just gross. Ew. Next story. I had a patient who was literally cut in half at the pelvis after a car hit him and pinned him to a telephone pole. Paramedics carried his legs in separately. He was wide awake and talking to me as we quickly put in a central line, and he He got all the bleeders ligated by like 5 different surgeons. He declined pain meds repeatedly. What a legend. He was in the OR 5 minutes later. Luckily, this was at a major academic center with an exceptional trauma surgery team. Apparently, guy lived. Not sure what his quality of life was after, but pretty crazy. Next story. I had a liver failure when I was 8 months pregnant. My baby had stopped moving for several hours, so they did a C-section. They found out during blood work that my liver had failed. I almost needed a transplant. I bled so much that my body had used up all of its clotting stuff. I was in ICU for 3 days, in hospital for 2 weeks. My liver recovered, and I went home with my son. We both could have died. The hepatology department and maternity department were working together, which is not a usual thing for them. It was acute fatty liver of pregnancy. Next story. Not a doctor, but I had a few doctors ask me that. Typically, if you get appendicitis, it'll rupture and sepsis will set in within a day or so. And when that happens, it gets bad real fast. So I got appendicitis. It hurt so freaking bad, but I didn't know I had appendicitis. I went to the doctor. He couldn't tell what was going on. He thought I had compacted stool and wanted me to take stool softeners, so I did, and it didn't help because, spoiler, it was appendicitis, right? And then a roommate who thinks he knows what he's talking about tells me that it's all in my head. I just need to physically get off the couch and exercise because he feels so much better after he exercises. Okay, dude. I can't even get off the couch to use the restroom without almost passing out in pain. He tells me to just play a video game to get my mind off it. I go to class, grad student at the time. I call the doctor and make another appointment. He doesn't know what's going on. I talk with another doctor and no clue. He thought maybe it's appendicitis, but I didn't have a fever and didn't have a recoil pain, so maybe it was gastrointestinal stuff. I schedule an appointment, meet with them. All the while I'm going to class and taking the maximum dosage of all pain relievers I can get my hands on. Finally, the GI doc scans showed I had appendicitis. Hooray! I go to the nearest ER and I say in a totally calm tone, "Hi, my name is my name. So my doctor said I should probably go to the ER because my appendix burst a while ago and I should probably be taken out or something." Turns out my appendix had burst and I held onto it for 3.5 weeks. I had a dozen doctors come in and some of them even saying, "Hello, my name is Dr. Such and Such and I heard you're the guy who has had a burst appendix for nearly a month and you're still alive. I'm not on your case, but I just wanted to meet you. How the hell are you still alive? How the hell did you drive yourself here and just waltz into our ER? I got that alien bioengineering upgrade where the abdomen moves around and wall seals off so the burst appendix doesn't leak everywhere. Edit. After my primary care physician learned I had appendicitis and he didn't diagnose it, he retired within the month. It was probably coincidental. Next story. ER doc. Oh my goodness, so many patients. Too many to tell. One good one though. I once took care of a guy in the rural south who came to the hospital because he said he was growing salt. And he was totally covered in what looked like snow. Uremic frost, I said, since I was fresh out of residency. Guy had been in renal kidney failure for 3 months and had been vomiting every day, which kept his potassium low enough that he didn't die. But it was still 9.7 and his ECG was a sine wave. He definitely should have been dead. Google uremic frost. It's a good one. Next story. I'm not a doctor, but I do know a story that surprised most doctors. I'm currently 19 years old. My childhood at first was quite normal, but everything became quite dark when my grandfather got cancer in his testicles. When he started chemotherapy, everything was very hard for him and the whole family. My cousins and I used to visit him after lessons. A couple of years passed and our grandfather recovered from cancer, but the smile was erased when they told us that he had metastasis, so the cancer spread to part of the rectum. He had to start chemotherapy again. Luckily, the cancer wasn't as serious as the previous one, although it sounds strange my grandfather survived and cured of the second cancer after a year. There were no longer any forecasts of any other terminal illnesses. At 17, my grandmother passed away, which made our grandfather move with my family, but being quite impatient, he would go out from time to sunbathe and feed the birds. He went to the park by bus and had done so one night, but my grandfather didn't come home. He took the bus, but the driver was drunk. The bus crashed, 4 people died and 7 survived, of which my grandfather was one of the 7. We didn't realize that he had disappeared that night. The next morning we found him in the hospital sitting as if nothing had happened. We all burst into tears as he complained about the decanter while laughing. My mother joked that God had forgotten to take our grandfather to heaven. This year my grandfather got the flu and we went to the doctor. After writing the medical history, the doctor almost dropped his eyes when he saw that he was still alive. Next story. Belligerent guy comes in a wheelchair. He does not want to be here. He says he's freaking fine. The party was good. EMS screwed up his evening. EMS brought him in from a bush party. The guy had a chainsaw stuck in his thigh and shin, literally jammed in his leg, and severe burns after falling into the bonfire on half of his body. Guy was hammered, didn't seem bothered by the fact he was severely burned or had a chainsaw in his leg. He ended up losing the leg below his knee and got a nasty infection from the burn. But still, if his leg wasn't completely screwed up, I'm convinced he would have gotten up and tried to fight people. Adrenaline plus alcohol is a powerful combo, it seems. Kinda too powerful. Something about that doesn't seem right. Next story. My sister was the patient, but every doctor who's gone through her whole file has had this reaction. When she was 9, she fell around 35 feet off a bluff and landed head first on bedrock, shattered every bone in her skull. A very well-known neurosurgeon took a look at her when she was brought in and said, "Sorry, there's absolutely nothing I can do for her. I'd say she had a 10% chance of surviving the night. Say your goodbyes now." 3 weeks in a coma, 3 months in an ICU, 6 months as an inpatient, and she's still alive today. She has permanent damage, of course, but holy cow, can kids' bodies recover from a lot. Next story. I'm a midwife, and we have patients who have massive obstetric hemorrhage, MOH, which is classed as any blood loss over 2 liters. This can happen for a variety of reasons. We had a patient who unexpectedly started hemorrhaging following an uncomplicated normal vaginal delivery, and we just couldn't stop it. As soon as we pumped blood in, it hosed out. The doctors had to perform an emergency hysterectomy and the bleeding stopped. I think it's fair to say that we were all shocked, not just at the incident itself, but at the fact that this woman lost 8 liters of blood. Also, that she spent just 1 night in intensive care before she was back on the ward caring for her newborn, and she was home in a week. Women are bloody awesome, excuse the pun. For reference, women usually have between 4.5 to 5.2 liters of blood circulating in their entire body. 8 liters? Very scary. Next story. I had lost a lot of blood to anemia and went into the doctor for something else. She starts looking into my eyes, my gums, pinching my cheeks, and tells me I'm severely anemic, and then said, "Are you always this white and pale?" And then I'm like, yeah, I guess. And then she made me take a test. Turns out my blood level hemoglobin was at 6.5 and dropping because of my heavy menstrual cycle and stomach issues and not absorbing iron. I'd gone to the doctor because I had really bad heartburn. Turns out I was really low on blood. It explained all the dizziness, coldness, eating ice by the pound, auditory hallucinations were happening, and I started to just not care about anything. Had numbness in my whole body as well, and trouble breathing. I'd been in such a dire state that I started to accept all of these things as normal. When I checked myself into the ER, I told them that my doctor told me to come in, but I think she was overreacting. I can probably just go home. They quickly tested me. My blood level had dropped a little in a couple of days, and I still had heavy menstruation. They quickly admitted me to start my blood transfusion. They said that had I waited, I would have likely gone into cardiac arrest or would have just died in my sleep. After the blood transfusion, I felt amazing. I could breathe and my skin color was back. Hey, look at that, guys. When you have blood in you, you feel a little better. Crazy stuff. OP, I'm glad you're doing better. I hope that next time your doctor tells you something like that, you, listen a little more. Like, don't get me wrong, you went to the ER. Huge. Great work. But also being like, no, I think my doctor's just overreacting. Turns out, no, your doctor was reacting. No over about it. Next story. I had a patient in the emergency room who had been involved in an awful car accident where firefighters and paramedics spent an hour trying to get him out of his car. Reportedly, he attempted to walk to the ambulance, and when he arrived, he was awake and talking. Confused to speech, but still. Then paramedics signaled the back of his head to me. His skull was popped open in the back so much that I could see inside. We paged the brain surgeon immediately, and the patient was taken directly to the operation theater. Months later, I heard from my colleague that he was still alive and had no damages other than some occasional balance problems. Next story. I'm a hospital medic, and my first serious trauma was a guy that got shot in the neck. Somehow it missed everything important and just went right through. Minimal bleeding, no C-spine damage, just a hole through his neck that didn't pierce his esophagus, trachea, trachea or any major vein or artery. Dude was just chillin' in the room. And then 2 weeks ago, we had a gunshot that would not have made it to the local trauma center. Hit his femoral vein, but was still gushing blood. One nurse stuck a finger in the hole and it stopped the bleeding, and I found a second wound in his chest. No bleeding at all. It just looked like a weird indentation. We couldn't even tell it was a gunshot at first. I stuck an IV adhesive sticker over it to vent and prevent a collapsed lung. The guy's blood pressure was in the toilet and wasn't able to read on the machine. We needed a manual check. By the time we got him sort of stable and with decent vitals, and we got a surgery team in early, we were drenched in this guy's blood. Pretty sure most of what was flowing through him was saline and other people's blood. He survived, though. We also had one woman whose entire abdomen was fully open under her belly and everything in her was horribly infected. We basically told her we can't stop that much infection, and she opted for hospice care. She was in so much pain, I don't know how her family even got her to the ER. I lifted up her gut to look underneath since I was the first in the room to assess, and I was hit by one of the most rancid smells I've ever experienced. Literally everything from the waist up was infected. There were some unnatural fluids draining right out of the completely open bottom of her stomach. I mean it when I say you could just lift it up and look right inside. Next story. Not a doctor, but a registered nurse. Last summer, between the months of June to September, we had a young male, 19 years old, who crashed his motorcycle and was sent flying through a van's windshield. By the time he came to my unit, he had gone through so many operations, and I heard he needed to have over 100 blood transfusions within the first month to keep him alive. He also ended up losing all movement and sensation from the belly button down, as well as losing his left arm. His right arm was intact, but barely functioning. Neurologically, he was with it, knew his name and that he was at the hospital, but I honestly don't think he knew what happened to him. His family members were very nice, and I could only imagine how they were feeling. I honestly have no idea how he was still alive. He couldn't sit straight up anymore because he would be in terrible pain 24/7, but if we laid him flat, he couldn't really clear his secretions. I'm surprised he didn't get pneumonia or aspirated or something else. We discharged him to a long-term acute care facility, and that's the last I heard of him, but it's just such a sad story considering he's only 19. Next story. 2 patients that give me faith in what medicine can do when I think about it, both quite young to be so sick. First was a woman who was very pregnant, and some genius doc agreed to put her under twilight anesthesia for an elective procedure that could have definitely waited, went into labor while she was under, and from there, had everything go wrong. Ended up in cardiac arrest. Was transported to my hospital and put on VA ECMO. She was in rough shape when I saw her first. Most people in her condition don't make it. I ended up seeing her a month later, walk into my OP clinic, and I got the creepiest feeling. It was like seeing a ghost. She was fine. Not like most people who come out of the ICU after that kind of stay. The second was a young guy who bled out in the ICU of a sudden hemorrhage. He was pulseless for about an hour. Without going into a bunch of details, he required several procedures after that which were risky on their own. It took weeks for him to reboot, but eventually he was responding to stimuli. After a couple of months, he walked out of the hospital. He wasn't dying, he was dead. For an hour. That these two survived is a testament to modern science. That they walked out of the hospital on their own, needing little to no assistance, and with their cognition completely intact, that is a miracle. Edit. I remembered another one that was pretty wild. This guy had very advanced cancer which had invaded the major blood vessels of his abdomen and chest. When they took him to surgery, his vena cava was involved and it just sounded like it was unraveled. They were not ready for a major cardiothoracic procedure, so they were just dumping blood products into him to keep him alive, while they could get someone to repair this major vessel. I thought the OP report had a typo because they said the estimated blood loss was 30 liters. I forget the breakdown, but they had put hundreds of units of blood, liters and liters of crystalloids and plasma. It's about 6 times the amount of blood in the average person. He was white as a sheet for weeks after this, but he made it. Next story. Currently a med student, but was formerly an ER nurse. While working as a nurse, I had this one patient who was originally from the Congo complaining of right lower abdominal pain, with a subsequent diagnosis of appendicitis. Nothing crazy about that. See it every day. The crazy part was the story he told me next. He said that he didn't think it could be appendicitis, and when I asked him why he told me this, when he was in the Congo, he was out in the bush trying to poach gorillas. Awful, I know. And then he developed lower right abdominal pain, nausea, fever, etc. Being out in the bush, far from medical attention, he and his buddy decided the best course of action was to cut open his abdomen with a machete and remove his own freaking appendix. After nearly dying from the surgery, he then went on to nearly die from sepsis over the next several weeks. I assume he was under medical care by this point. Somehow, he manages to overcome nearly impossible odds and survives, and years later, immigrated to Canada where he develops appendicitis again. So after hearing this, I was equally amazed as well as skeptical, but he showed me his scar, which I thought was fairly validating. I told his surgeon the story and asked why he would still get appendicitis, and they said most likely they just didn't remove the whole thing. I know this is all hearsay, and it is definitely possible it was exaggerated or even entirely fabricated by the patient, but if it's true, it's one of the most badass things I've ever heard, and definitely belongs here. Alright, I'll give it up. Poaching, terrible. DIY appendix surgery? Insane. Not a full appendectomy, they tried their best, but nonetheless, it got him there, I guess, with, a few weeks of sepsis. But hey, what good medical procedure in the jungle doesn't have a little bit of sepsis, am I right? Next story. Not a doctor, but my future brother-in-law was definitely one of those cases. When he was about 5 and my fiancé was 10, their family went to go visit their grandparents who own a significant amount of land. Grandparents gifted my fiancé one of those mini four-wheelers for kids. This thing did a significant amount of speed, I don't recall how fast my fiancé said, and grandparents obviously made a rule that brother-in-law couldn't ride on it alone, and both had to wear helmets at all times. Well, brother-in-law really wanted to ride it and snuck on when nobody was looking and just took the hell off. About 30 feet, before slamming straight into the back end of the grandparents' Suburban. From what my fiancé has told me, brother-in-law can't remember any of this accident. It was bad. He cracked his skull, tons of stitches all over his face, knocked out some baby teeth, and wore headgear for almost a year because he screwed up his head. The doctors told my in-laws that it's amazing he survived and a miracle that he didn't have permanent brain damage. He's a pretty cool kid now at 18 and will be my fiancé's best man. Next story. My blood sugar was over 1,000 when I was diagnosed with type 1 diabetes. I was less than a year old. My mom had taken me to the doctor's office 4 times in 3 days, but the nurse called her a nervous mother and sent her home. Also diagnosed with Addison's disease a couple years ago. I'd probably had it for months and had been living on my own in a town where I knew nobody. The day I got home, I basically had a conscious blackout. Happened a few more times over the next couple of weeks, and I lost the ability to sense low blood sugars. When I was finally hospitalized, I was in Addisonian crisis. Took them 3 days to bring in an endocrinologist, and he knew what was wrong within minutes. They told me my heart would have stopped within a week due to low sodium/high potassium. Next story. My grandfather is a medical anomaly. His doctors hate him so much. He cut out a cancer lump with a pocket knife. I was like 9 and held paper towels. Cut his thumb in half, stumpy. Then the pointer on the adjacent hand, the long way, looks like a claw. Cut a hole in his middle. I was young and helped clean and bandage. Survived a stroke. Has a brain aneurysm, a hernia, and like 4 teeth. He's a freaking mess, but still kicking. Next story. This was many years ago, so I can't recall the exact details, but basically, we had a lady on ventilation with sepsis and multi-organ failure. Renal failure, respiratory failure, metabolic acidosis, deranged liver enzymes, the whole works. We counseled the family and they agreed to withdraw life support, so DNR was issued and we took her off the ventilator. A few days later, she's still around. Unconscious, still in full-blown sepsis with a multi-organ failure, but brainstem functions were there. I remember looking at her charts with my registrar, I think resident in the US, and my registrar going, "But how?" Then one day, maybe about a week on, during visiting hours, the patient's son approached us before he left to thank us for looking after his mother. His parting words were, and I kid you not, "I don't know if it's relevant, but my mother practiced black magic." My registrar made the ward sister contact the hospital chaplaincy team to inquire if they do exorcisms. They don't. Next story. Not me, but it's this thing my dad used to tell my sister and I. My dad served during the Gulf War and said he had to work on a guy whose head got ran over by a tank. What happened was a Marine fell asleep against the treads and the tank drove over him. Guess the fact they were in sand and wearing a helmet saved him, but only barely. My dad said the guy was still incredibly messed up. He never went into specifics. Next story. I work in an ER in Lebanon where the construction safety regulations are a bit lax. A few years back, I remember that construction workers were falling off buildings like dominoes. One guy came in having fallen from a few stories up and got impaled by an iron bar. bar that went through the back of his neck and out his left eye socket. Guy was alive and talkative when he got to our ER. Rushed down into surgery. Apparently it had missed every vital structure somehow, and the guy didn't even lose vision in his eye. Okay, if it sounded like I got a little heated at the end of that, I kind of did. What do you mean he didn't lose vision in his eye after a metal bar pierced straight through it? Okay, I am not saying I want him to lose vision in the eye, but I'm saying it doesn't make any damn sense, does it? That's incredible. That dude must be the main character or something. Next story. My old roommate's wife came to our apartment one night after working in the ER. She's an NP now in a practice, but she worked in a hospital for a while. A patient had jumped off his third-story balcony and landed in a bush and was totally fine, so naturally, tried again. The second attempt, a branch got lodged up his butt. When they removed said branch from his butt, he lost the elasticity of his sphincter muscles. The man will never be able to not crap for the rest of his life. Next story. Not a doctor, but my cousin was in a terrible motorcycle accident a few months ago. She had to be life-flighted to the hospital where they found out her ankle was broken, her hip was shattered, and I believe there may have been a tear in an artery somewhere. Oh, and the big one, she was internally decapitated. She was rushed into surgery to reattach her skull to her spine, and they had little hope she would ever walk again. It's now been less than 6 months, and she's back to work as a nurse. Wow, OP, you sure know how to bury a lead, don't you? What do you mean internally decapitated? And you led with, oh, her ankle was broken. Come on, man. Next story. Not a doctor, but late last year, my dad went to the hospital early in the morning with terrible stomach pains, thinking he had a bad ulcer. My mom called me at 7 a.m. to tell me he had a heart attack. A couple hours later, after an angiogram, the doctor tells us that he has multiple artery blockages, including the LAD, commonly called the Widowmaker. He's probably been having heart attacks for years and has just shaken them off like they're nothing. He had a quintuple bypass at 8 a.m. the next day, and he is almost totally recovered. We're looking forward to going to a theme park this summer and riding roller coasters with the doctor's approval, of course. Next story. First day of my emergency medicine clerkship, saw them wheel in a motorcycle accident guy who had dozens of broken bones, arms, legs, skull, etc., amongst significant soft tissue injuries. GCS was in the single digits. Had a decent pulse when they brought him in, but it was fading fast. Fast scan showed he was pretty much bleeding into every space in his abdomen and pelvis. The guy looked dead. His co-rider had already been pronounced dead in the field. Hands and feet were the same color as the white sheets on the gurney. Pulse was barely palpable, lips were blue, etc. Anyway, the trauma surgeon apparently sees something or has a flash of inspiration. I stepped away for like 5 minutes while they were putting in chest tubes to go check on one of my other patients in a different room, because as I head back over to the trauma bay, they're whisking this guy off to the OR. I hear from a nurse the next day that they cracked his chest, called in vascular and CT surgery in conjunction with the trauma surgeon to stop all the bleeding, closed him up once he was hemodynamically stable, but obviously in grave critical condition. There was no telling in the short term what kind of neurologic deficits you'd have from the fact that at one point, 80% of his blood was chilling in his abdomen rather than his vessels. Hell, I didn't know if the guy's spine was intact or if he'd been paralyzed just from the physical trauma. Anyway, lo and behold, exactly 30 days later on my last day of emergency medicine, I bump into the guy and his family members leaving the hospital through the main lobby. They're holding fresh discharge paperwork in hand. He's being pushed in a wheelchair because you can't really use any arm strength without splitting your sternum open after the kind of surgery he had, but dude looks good. He's laughing and joking with his wife and trying to tell her that he can walk out of here if they would let him. Pretty crazy considering when I saw him, he was pretty much a broken corpse. Next story. Not a doctor, but I met a few, and curiosity gets the best of me, so I always ask, what's the most screwed up thing you've ever seen? I was hitchhiking across Canada, and this doctor picked us up, so I asked once again. Buddy said it was an inmate they had to have on watch for taking his own life. He kept swallowing razor blades. Once he got cut off, no pun intended, he just scrounged in his crap to eat all the ones he would pass. Next story. Not a doctor, but one Friday around lunchtime, I started having pains in my stomach. Thought, maybe I pulled a muscle at work. Pushed through the pain till Saturday morning. Woke up in the worst pain I've ever felt. Only time it didn't hurt was when I tried to poop. Went to the ER, talked to a doctor, and was sent to take a CAT scan. While in the scan, I started throwing up this black crap, and I was rushed to the OR. Well, I was freaking out, and no one was giving me an explanation as to why I was being rushed to the OR, so I pulled out my IV and walked out. Went home, and hospital called me 140-something times to try to get me to come back in. Sunday morning came around, and I feel like death. I fall out of bed and can't get up. Ex-girlfriend calls 911. Paramedics show up and say, yeah, we've been waiting for you to call. Find out my appendix ruptured Friday. When I woke up Tuesday, the doctors made sure I knew how lucky I was to be alive. He also asked me to sign a disclosure so he could share my story and pictures of my appendix in a book he was writing. Said I was minutes away of dying due to being septic. Okay, so OP, are we going to address why you decided to leave after throwing up black crap in your scan? Like, was this just the worst possible outcome of an anxiety attack at the worst time, or what happened? Why did you think that just leaving and not answering the calls from the hospital was a good idea? I feel like we're missing something here. Either that, or OP might be... No, I'm trying to think of how to sugarcoat it. I can't. Dumb. Next story. Not a doctor, but I contracted meningitis when I was 2 years old. I was rushed to the hospital, and the doctor immediately diagnosed it and had me sent via ambulance to the children's hospital an hour and a half away. Small town doesn't have the resources to fight such things. The ambulance actually broke down about halfway there, and they had to send another one to pick us up. I spent 2 weeks in the hospital, and the doctors kept dancing around when my parents would ask about my condition. They kept getting vibes of, it's unlikely he lives through this, but they just didn't have the heart to tell them. For those unfamiliar with meningitis, it can be very lethal, and those that survive often have a lot of complications like limbs that are amputated or other defects of the body. After 3 or 4 days in the ICU, I finally started reacting to the treatment. Not only did I survive, but I also walked away with only 97% hearing loss in my left ear. No amputations and no other defects. 26 years later, and here I am typing this story out while I rock my 2-year-old to sleep. Next story. I had an adult patient who was missing the right half of the brain. He had a severe brain injury, likely got a stroke during infancy. Infant brains are amazingly plastic. They do a great job in recovery. He had mild to moderate cognitive impairment. I saw him when he was in his 40s. He got a CT scan of head for some unrelated reason, and I had a similar reaction to most of you around. Then I remembered, brain is brain. It's weird. Next story. Not a doctor, but a patient. I was in the hospital after a pretty gnarly 4-wheeler wreck. I was destroyed. Fractured my skull, broke 3 ribs, my right shin, it was sticking out of my leg, broke my collarbone, my right arm, had some pretty bad cuts, bruising, fractured 3 vertebrae in my lower spine, and internal bleeding. I've had a pretty high threshold for pain basically my entire life because I've always been clumsy/stupid, but that was god awful, even after I was given pain meds. At some point, I don't exactly know when it was, I was in and out quite a bit, I heard 2 doctors conversing outside my curtain. One of them said, "I don't know how she keeps regaining consciousness. There's no way she should be awake right now." The other doctor replied, "Honestly, I don't know how she's even alive." I think they thought I was asleep, I don't know, but that scared the hell out of me. Next story. Just thought of a case I had while working in stroke rehab. Not a doctor, but I saw her scans. Like 60 to 70% of her brain is gone. The woman had a headache years ago when she was in her 30s, went to the ER and doctors told her it's a flu, gave her painkillers and sent her home. Needless to say, it got worse. She went to the hospital again after at least 24 hours. Think she waited for hours in a bed before getting an MRI, and by then, according to her family, she's already not that conscious. The doctor said it's a small hemorrhage that bled slowly and the tear got bigger. She got emergency decompression and clot evacuation, but it's still 36 to 48 hours too late. She lived because the op saved her brainstem and her family is well off enough to afford care staff and continuous rehab. But her mentality is like a baby and she could not even sit up. Sometimes I wonder if saving a life is the right thing to do. Next story. Nurse here. Took care of a man who had a platelet of 4. Yeah, 4. Minimum is 150,000. I was surprised he didn't bleed to death from just turning in bed. Had to send him from nursing home to the hospital at that point. Then he came back and still had a platelet of 4 when labs were done a few days later. Out he went again and came back. Did labs and platelet were 3. Sent him out again. He finally came back and was admitted to hospice. He had this rare form of thrombocytopenia, and while platelet transfusions were given, they didn't help much. I was amazed those 3 to 4 platelets kept him from bleeding out that long. Him and his family were very nice, though. Well, I don't know about all of you, but I don't know half the words OP said. I do know, however, that when you're supposed to have 150,000 of something, and you have in the single digits, you are probably a little worse for wear. Next story. I'm not a doctor, but I am the patient they said that to. When I was born, my heart stopped. They couldn't find any brain activity for a solid 2 minutes and pronounced me dead. I am not dead. And there was another time where I had an anaphylactic reaction and my heart once again stopped and my brain didn't show any activity. This time I was pronounced dead for 5 minutes. I am not dead. There was one time where I fell down half of a cliff and lost about a little over half of my blood, and they thought me to be dead for the entire ride to the hospital. I am still not dead. OP might be the first human in the world who can respawn. Just testing out his powers when he was born, I guess, and then has done it twice since then. Use your powers for good, OP. Use them for good. Next story. Obligatory, not a doctor. Got a call at work that my partner at the time came into the ER after an accident. Was told he came in semi-conscious but was now alert, etc. Don't rush in because it's not critical, but come in as soon as possible. I spent maybe an hour chatting with him, who was indeed alert and normal, joking with doctors and nurses, before being asked to join the nurse in the hallway. Dude's BAC was over 0.40. I knew what that meant because as a bartender I've taken enough certification courses to understand blood alcohol content. Plus, I studied enough neuroscience and anatomy in college to know where the line between dead and alive is. He was well past where dead should be, or at least comatose, plus had been thrown headfirst into a tree from a moving car. But he was just chilling, cracking jokes, even had a mostly intact recollection of the night and the crash. The look on the nurse's face when he told me the blood alcohol content is one I'll never forget. I know higher levels have certainly been recorded, but it was pretty clear this guy hadn't seen one and was beyond shook. It was a wild ride. Next story. Not the doctor, but the patient. Obligatory. For some backstory, I've always been a fairly tall and lanky white boy, and had a pretty bad bout of walking pneumonia at 15. Later on, I had a spontaneous pneumothorax at 18. My lung popped. I was sitting out on the back porch of parents' house, texting my girlfriend at the time, and was just generally taking in a nice, quiet afternoon in rural Vermont. Damn, it was a nice day. My brother came home from a class, union pipe fitter, and asked if I wanted to go somewhere. Can't recall. I shot up from the chair and I felt a weird, sharp, almost cold sensation in my left side. I didn't think anything of it, and we made our way downtown. I'd been feeling a strange twinge every now and then from the left side of my chest, but nothing bothersome enough for me to worry. After a good few drinks and several hours, we made our way home. I crawled my butt out to my brother's short sedan. Sure enough, I feel that strange sensation in my right side this time. Still not a clue what it is. Didn't really feel like a big deal though. My breathing was a smidge harsh and my left side hurt a bit from earlier, but I figured I just screwed up a muscle somehow. I wake up about 9 hours later and I can barely breathe and hardly move. Every upper body movement is a task. I managed to roll off my bed and crawl out of my room. I'm on the basement floor / first floor for Europeans. I'm gasping for air with every swing of an arm to drag myself closer to and up the stairs where my parents are having breakfast. I get to the top step and I'm wheezing, shallow breaths because I can barely breathe. I'm damn near sure I'm about to die. My mom rushes me to the ER and tells the staff at the desk I'm dying. Not far off from the truth. I get rushed into radiology to confirm what's going on and to see the extent. Both of my lungs are about 90% collapsed. I don't recall much after walking into the ER. My O2 stats were screwed up and I was already losing consciousness. But I woke up about 12 hours later with 2 tubes in either side of my back draining the air. I had a surgery a day later to remove blebs, skin tags, from the surface of my lungs. Since then, I'm A-okay. Open water and nitrox certified for diving, avid hiker, whatnot. My thoracic surgeon was shocked I hadn't died in my sleep given how far gone my lungs were and where my O2 stats were at by the time I got in. Look, I'm gonna keep this $1.50 with you guys. I said O2 stats. It's absolutely O2 stats for like saturation. I don't really want to go back and do it again. Sorry. High quality content. Next story. Not a doctor, but a witness of a doctor saying this to my grandpa. The guy wasn't even 40 when he was diagnosed with esophagus cancer, which has spread to his lymph nodes and his neck. He was operated on, but was told he would probably never be able to eat solid food again and have difficulty speaking, as the main tumor was located on his larynx. Chemo and radiation was used to treat the spread in his neck, but there was a high chance he wouldn't survive it, as the smaller tumors were inoperable. He survived. He learned how to swallow again and regained his speech, All was good. Then he had a stroke within the year. Doctors thought it could be his artery in the neck damaged from radiation treatment that created a clot. So as he had just recovered, he was now unilaterally paralyzed by the stroke and again unable to speak or swallow. Years later, he is now able to speak and swallow again, and part of his paralysis has recovered, or he has a way to work around it. Cue him being 50. Cancer strikes again. He now has tumors in his prostate, which has spread to his testes. They remove most of it, and radiation and chemo do the rest. Now the poor man has no testosterone production anymore, so he is put on artificial testosterone. He is now almost 80, and a few years ago they found multiple dormant tumors, some in his bones, and one in his prostate. They've been treated with chemo and are now under control. He is weak as a stick sometimes, but always recovers. The last time he was in the hospital, his doctor said to him that he has never seen a person going through so many illnesses and cancers for 40 years, each of which had a slim chance of survival, but always recovering. My grandpa, a slightly religious man, said, "When the angels are calling and I think I might finally lose the fight, I turn off my hearing aid, so I keep fighting." Next story. Patient here. I had a giant tumor pressing on my spinal cord. It's a kind of tumor that is super rare to be located in the cervical spine and exceedingly more rare to have so young. When the doctors found it, they said I could have been paralyzed from the neck down in a month or so. I was in surgery in less than a week. The tumor was also pressing against the important artery that is right next to that area of the spine. There was a chance I would bleed out during the surgery if it was accidentally nicked. Also, the surgeon said that if the tumor had damaged the nerve ending it had started to grow on, then I would lose usage of my right arm. I'm only 21 and I'm right-handed. 6.5 hours of surgery later, I wake up with an 8-inch incision down the back of my neck and no in-surgery complications. My arm works just fine and I have all the feeling in my body that I had lost. I'm finally able to tie my shoes again after losing fine motor skills in my hands. I have an appointment on Thursday to see if the tumor is growing back at all. Wish me luck. Next story. Not a doctor, but a ski patroller at a major resort in Utah. Responded to a skier versus tree call. Never good. He hit the tree going really fast. We showed up and the guy was literally wrapped around an aspen. He wasn't breathing, so we pulled him off the tree to open his airway. He gasped and coughed and blood flew out of his mouth. But he was breathing. We moved him into a better position to work on him. Cut his shirt and jacket off and his entire chest was smashed. Way past flail chest. It seemed like all of his ribs were broken. His skin looked like it had sticks all under it. He's gasping and blood is coming out of his nose, mouth, even his eyes were bleeding. He stops breathing. We start CPR. I remember doing compressions and I could feel his bones poking my hands. We worked him on scene for about half an hour while the flight crew showed up. When they got there, the flight doc put a tube in to drain his lungs of blood. He put the tube in, looked at me and said, "Hold this drain so it all comes out." So I grab it and blood comes out like a garden hose, soaks my uniform. It's all over me. So much blood. The snow is red all around. They load him up with a pulse and take off. After they left, myself and another patroller stayed to shovel up the bloody snow so the other guests wouldn't see too much. Then I had to go in and turn in my uniform and shower. As soon as we first showed, we thought this guy was going to die on the mountain. Turns out the guy made a full recovery and brought us all a few cases of beer the next winter. Skiing is dangerous, y'all. Be safe about it. Okay, I'm sorry, he came back? It better just have been for a visit, because if that ever happens to me, you can bet I am not skiing again in my life. That is a clear sign, and I can read perfectly well, thank you. Horrifying. Next story. Not me, but a story from a friend. Patient came in having been bleeding from her anus for 2 weeks. Not, oh, there's a little blood in my stool when I poop, actively dripping from her butt, to the point where she had to wear a diaper all day, every day. She fainted 3 times from the loss of blood, and only after the third did she think, this might require medical attention. Next story. I was caring for a patient on the med-surg floor in nursing school whose kidneys were basically non-functional. His BUN and creatinine were through the roof. I'm fairly certain his CR was in the 60s, and his GFR was 3. GFR basically shows how well your kidneys are filtering, and it's supposed to be above 60. This guy's weren't doing crap. I asked my instructor what kidney levels were supposed to be fatal, and she said that before that day she would have said this guy's levels were. The guy's refusing dialysis too. The nurses made it sound like they had tried to educate him, but when I went in there and asked him about it, he seemed very unsure, and said his main reason was that some of his friends said not to do it because it sucked. Found out those nurses actually just sucked and didn't educate him at all. So I told him, I really think you need to at least talk to a doctor about that option, because it's probably going to be necessary for you. I hope he took my advice. He wasn't there when I came back the next week. Next story. Sadly, I'm a little late to this party, but I thought I would mention a man I once treated as a patient many years ago when I worked in a small town by the sea. I will call him Mr. M. Mr. M was a small town solicitor. There are not so many of them left in the UK now, but Mr. M and a couple of partners worked in a small solicitor's office, doing the usual round of wills, conveyancing, small-time disputes between neighbors, and so on. Mr. M was middle-aged, very overweight, suffered from a high blood pressure and diabetes, and not a very active man. He was married, and Mrs. M was his opposite, thin, anxious, and a bit overactive. They had a childless, rather unhappy marriage, for reasons not relevant to Mr. M's story. I knew Mr. M's health problems had him marked for an early grave, and that if we could get his weight down, his blood pressure and diabetes, neither of which were well controlled despite everyone's best efforts, would improve. Naturally, I spent a lot of time trying to deal with this issue. The usual round of advice, referrals to the dietitian, diet sheets, regular weight monitoring sessions, etc. Nothing made any difference at all, despite Mr. M continuing to sadly tell me how hard he was trying and how carefully he stuck to his diet. One day I think my frustration started to show and Mr. M seemed sadder than usual. I took a new tack and asked him very sternly to talk me through what he did and ate on a typical day. We chose the day before. Slowly and reluctantly, this was his story. When he got up in the morning, he would go downstairs for breakfast made by him for his wife. Breakfast would be 2 rashers of bacon, 2 sausages, 2 fried eggs, a fried tomato, and a slice of fried bread. This he would follow with 2 slices of toast and marmalade, and coffee with cream. Arriving at work, he would have a cup of coffee and 2 or 3 biscuits. After a couple of hours of work, he would walk down to the local baker's to buy a cake or donut for a mid-morning snack. Sometimes he said he would be hungry enough to buy 2 cakes or donuts. Around 12:30, exhausted and hungry, he and his partner would walk over to the local pub, where he would drink 2 pints of beer and have lunch. He quite liked the pub's pie and chips, but sometimes he would have steak and chips instead. He would usually follow this with something like apple pie and custard or chocolate fudge cake with cream. In the afternoon, his snack was usually only a couple of chocolate biscuits. This was all bad enough. But then, he told me that on the way home, this would be between 5 and 6 in the evening, he would stop at the local fish and chip shop for a meal of fish and chips with mushy peas. When he got home, his wife would cook him dinner. Usually, this was some sort of roast, perhaps roast beef with roast potatoes, veg, gravy, and Yorkshire pudding, followed by a dessert, perhaps apple pie or maybe trifle. Oh yeah, and they always had a bottle of wine between them. After his wife went to bed, he liked to sit up and watch a film on the TV, accompanied by a liter of Coca-Cola, not diet of course, and a family bag of some snack or other, or a packet of chocolate biscuits. He did no exercise at all. Remember, this was back in the 80s. This revocation absolutely stunned me. No wonder this chap's health problems couldn't be controlled. After I left the area, having made no headway on his problems, I used to run back from time to visit and occasionally would see him around town, usually in the baker's. How he continued to stay alive remained a mystery to me. What I don't get is this guy said he was trying, right? So what does him not trying look like? Because you can't tell me that this is him trying his absolute hardest. Surely after his second apple pie in the day, he must be like, maybe there's something I could do better. But maybe not. Maybe he just has no clue how nutrition works. Anyway, that's the last story for today. It wasn't quite as happy as I thought it would be of a thread, but as far as medical threads go, hey, I'll take it. Anyway, thank you so much for watching. I hope you have a wonderful day or night wherever you are, and I will see you in the next one.